Hi there everybody, my name is Jayton Cranmore and welcome to another week of Anatomy at SI. Today we'll be covering Lab 3, which is going to discuss the vertebrae and then also our thoracic cage. And so the big piece with this one is go ahead and pull out your lab manual and try to follow along with me and try to visualize some of these structures as we go through them. The other thing is that I also watched our video from last week, and so thank you so much for bearing through it. And even though it's just me here in the anatomy lab today, I want you to know that these videos are homegrown, home produced here on the UW-WYO campus. They are edited by yours truly. And so I do apologize for some technical weirdness. But anyway, let's get started with section 1, the pectoral girdle. So our first bone in section 1 is going to be the clavicle, right? The clavicle is a pretty interesting bone in that there's only two things on it that we need to really know. And so out of those two things, it's just the two ends, right? We've got this guy right here and this guy right here. Now, the important piece about these two ends is that they're both very distinctly different and they're easy to confuse with one another. Now, the first one is called the sternal end. This is the sternal end because it attaches to our sternum, right? If you look, the sternal end is kind of big and widely shaped as compared to the other side, right? It almost looks like a stamp, like what people use to stamp their name when they don't want to write it over and over again, right? Yeah, sternal end looks like a stamp. Stamp, sternal, not this one, this one. The sternal end looks like a stamp. All right, now for this other side, right? So if we've got the sternal end, we've also got the acromial end, right? Now the acromial end is called the acromial end because it attaches to the acromial process on the scapula. We'll talk about that in just a second. So that acromion process is going to be flat, right? Not looking like that stamp end. We got a flat acromion and a stamp-looking sternal end. Now, for the next bone, we've got the scapula. The scapula has a lot more going on to it, and quite honestly, it's not as bad as it may seem. The biggest deal with this one is that there are 2 or 3 structures that are distinct, and the rest of them, we can use some of the terms that we use to orient ourselves on the body to figure out where they are. So, for the first one, you already know what it's called. It's called the acromion. Why would we call this the acromion? Right? Because it attaches to this acromial process. And so since we've got that acromial process right there, right? Oh, sorry. Want to make sure we're doing this right. So we've got our acromial process attaching to that acromion right there, that flat end. Can you see that? So this right here is going to be our acromion on the front side of our scapula. Next, we've got the coracoid process. The coracoid process is going to be this C-shaped looking guy, right? Kind of juts off from the supraspine or from the spine, right? And so this coracoid process is going to form a C shape on the scapula, right? C shape. C is for coracoid. We've got our coracoid and our acromion. You can remember that our acromion process is anterior. The A's go together, right? Acromion is anterior. Acromion is anterior, right? All right. Next, we've got the glenoid cavity. And so the glenoid cavity is, well, it's aptly named in the fact that glenoid or gleno means shoulder, right? And so when we think of glenoid or gleno, just think shoulder. And that's going to show up again later in our lab manual, right? Whenever we talk about the glenohumeral joint, right? We've got the glenohumeral joint. That's our shoulder joint. Gleno and then humeral, right? Humeral bone, gleno. But anyway, I'm getting too wrapped up into it. If we look back at our model right here, we've got the glenoid cavity right there. The glenoid cavity is where the socket or the ball of our humerus is going to kind of slot in up in there. This is called the humerus. This is the upper arm bone, right? And it's going to slot in right there on that glenoid cavity. Next, we've got the lateral border. Now, do you remember which way lateral goes? Think about that in your head for a second, right? Okay, right. Lateral is going to be away from our midline, right? Away from midline. So think about which side is going to be closer to our midline. Is it the side that has the shoulder attachment, or is it the side that doesn't have the shoulder attachment? Right? It's not going to be the side that doesn't have the shoulder attachment, right? Our shoulder does not attach into our body up inside, right? It attaches on the outside. That way we can be on, use our outside appendage. Our arm doesn't reach inside of us, right? And so because of that, the lateral side away from midline is going to be on the same side as that glenoid or that glenohumeral socket, right? That glenoid fossa. So we've got our lateral side right here. And if we know which sides are lateral, are away from midline, we can also figure out that our midline towards the middle is going to be that opposite side. So we've got that medial border on this side. Lateral border, same as the shoulder joint, and the medial border, which doesn't have anything. Awesome. So next, we've got the superior angle. Superior, what does that mean? Think about it. It means up, right? Yes, absolutely. I hope you said that, right? Superior means up. So whenever we think superior, we're thinking up. We see superior angle right there. So this is from an anterior view. If we flip and go inferior view, there it is, right? It's that superior angle, the angle on the superior, the upper side, right? All right, from there, let's find the inferior angle. If we've got the if we've got the superior angle right here and the inferior one right here, inferior is gonna be down here. Inferior angle, superior angle, inferior angle. Next, we've got the spine. The spine runs off the back or the inferior side of our scapula, right? We've got our anterior side, here's our inferior side, and that's gonna have that spine running off of it, right? Not to be confused with our actual spine, this is the spine of the scapula. Okay, next we've got, importantly, we use the spine to help kind of figure out where some other things are on the body, right? Or at least on the scapula. And so we use it as a defining region. Hence why we have supraspinous and infraspinous in our terminology, right? We've got spine. Supraspinous is going to be right up. So supraspinous fossa is going to be right here, right? On the inferior side, the supraspinous fossa is the fossa that's above this spine right there, right? There's the supraspinous fossa. Now, if we know where the supraspinous fossa is up here, where's the infraspinous fossa? Well, hopefully it's down below it, right? Hopefully it's back down here below the spine, infra, right? The opposite. We talked about, in SI, we've talked about how some words have opposites, just like how some words can mean the same thing, like a synonym, right? There's also antonyms where they mean different things. So like how we've got supra versus infra, right? If we know what supra means, it means up. We know what infra means, it means down. Supraspinous fossa, infraspinous fossa. And so we've made it to the last piece. The last piece is the subscapular fossa. That's going to be on the anterior side, right? If you think sub, meaning below, kind of like submarine, right? Or sub-sandwich because it goes below down into your stomach. I don't know. I'm trying here. We've got the subscapular fossa because it's down below, underneath, right? On the anterior side, here's the inferior side with our supraspinous fossa on our infraspinous. We flip it to the anterior. We see that subscapular fossa right there. Okay. Let's go ahead and dive into section 2. So for section 2, let's go ahead and look at some typical features that we would find along the vertebrae that are in our spine. Now, important to note, not all of the vertebrae found from the start of our spine to the end of our spine look the same. They all have some different functions and forms that help them perform the different duties that they have along the spine. But for the time being, let's go ahead and talk about typical structures that you would normally see on any given vertebrae in the spine. Now, first, we've got, this is a thoracic vertebrae, but that's not important. Remember, we are looking at general structures that you would find on most vertebrae. So the first one that we have is going to be the body. The body is going to be this large region right here. It's the load-bearing region of our spine. And if you look at a model, or like a full body model, you can see that there's often discs in between these, right? And there's no different for our body. We've got these discs that sit between each vertebrae and help kind of cushion that weight. But this is the load-bearing region, that body, right? It bears the weight of the body. Next, we've got the vertebral foramen. The vertebral foramen is going to be this giant hole right there, right? It's the only hole that you can see on there. It's super big. The vertebral foramen, it allows for the spinal cord, a huge bundle of nerves to kind of pass down through our spine, and it helps us control all of the different features of our body. But importantly, it has to have space to run through the spine. So the spinal cord runs through the spine, or through the vertebral foramen. Next, we've got the vertebral arch. So when we're looking at the vertebral foramen right here, we see that it's formed by this giant archway kind of over the body. And that archway is called the vertebral arch. And it's made up of two separate structures. The first structures are pedicles. Pedicle, pedicle, right? The two pedicles are going to hold up this whole structure, right? This whole archway. And it can be kind of helpful to think about the pedicles like the walls of a house, right? Here's our pedicles. There's the walls of our house. They're gonna hold up the roof, right? They're holding up this big, large structure right here, and they're bearing the weight of it, right? Next, we've got the laminae. The laminae are going to be these two structures right here. They help kind of form the top of that archway, right? Or the roof. So if you look back to our little analogy right here, we've got the two laminae right here, right? Laminae, laminae, and then we've got the roof right there. And as you can see, pedicles, laminae, pedicles, laminae. It kind of forms a house, right? So if you can see it that way and kind of remember that the pedicles are the walls, whereas the laminae are the roof, it'll help you remember that and keep those two terms straight. All right, next, we've got the spinous process. So if we've talked about everything else on the vertebral arch, what about this thing right here, right? That's the spinous process. And if you take your hand and you run it along your back, you can actually feel the spinous process on most of your vertebrae going down your spine. Kind of cool, right? And if you can't feel them, I'd suggest seeing a doctor because that's probably not very good. But anyway, let's continue. So if we've talked about the spinous process and we've talked about all of the archway features, right? The two pedicles, the two laminae, and then the spinous process. Next, we've got the transverse process, right? The transverse processes are going to be this one here and this one here, right? If you remember, your transverse plane goes this way, right? Those two structures fall along the transverse plane no matter how you hold this model. If you can remember your transverse plane, those two processes are going to line up with that plane, right? The transverse processes along the transverse plane. All right, and then along those processes, we've got a couple unique features, right? We've got the superior articular process and the inferior articular process and facet, right? And so let's look at those two structures here. Let's tilt this back down. We see that there's this upper region right here, right? And we know that when our spine is all placed together, it connects up. See that little connecting point right there? Right? These vertebrae are stacked up on each other. And so there's connecting regions along the tops and bottoms of them to help kind of keep everything compact in, right? So we've got the superior articular process and facet, and then the inferior articular process and facet. And it's important to remember that if you're looking at it like this and you say superior, it's not up. Why? Why is it not straight up when we say superior? You're looking at the model like this direction. Any ideas? Okay, well, the answer is patient view, right? Now, not all of us are going to be healthcare providers, but I am. And so whenever I think patient view, I think of looking at the patient from, their view, right? How does the patient orient their body versus how am I looking at their body? Because it might change how different structures look, right? Now, if I'm looking at it from my view, superior's up, right? Patient view, if this was the patient's spine, superior would be up that way, right? Because their head would be up here, feet would be down here. Not like that, right? That would be weird. But think about it like this. Head up here, feet down here, superior, inferior. So we've got the superior process, right? Superior articular process and the inferior articular processes right there. Awesome, so we're past all those general structures with our vertebrae. Let's go ahead and dive into some of the more particulars on each of the different sets of vertebrae that we have. First, let's figure out how many of each vertebrae there are. So, key thing here is if you can't remember how many of each vertebrae there are, just remember what time you eat, right? So for cervical, there are 7 of them, right? C1 through C7. What time do you normally eat breakfast? At 7, right? Yeah, so cervical, 7, breakfast, right? For thoracic, no different. I eat lunch at noon, right? Thoracic, 12. There are 12 thoracic vertebrae. C7, breakfast, thoracic, 12, lunch, lumbar, 5, dinner, and sacral, 5, dessert, right? If you can remember what time you eat during the day, right? Breakfast, lunch, dinner, and dessert, you will have all of these down. Try to remember the order of them and try to remember how many of each of them there are by remembering the hours that you eat every day. Okay. So now that we're past that, let's go ahead and dive into the cervical vertebrae. First, we have C1. C1 is going to look like this, right? So we've got C1 right here. C1 does not have very many unique features about it. It's called Atlas, right? Why is it called Atlas? Well, for any of you Greek mythology fans, we know that there is a Titan in Greek mythology called Atlas, and he is tasked, or not tasked, but more punished by Zeus and told that he needs to hold up the world for the rest of existence, right? So he's carrying the entire world on his with his two hands or on his back, right? And so Atlas is doing that. This vertebrae, Atlas, is carrying our head, right? C1 sits there to carry our head. No different than that Greek Titan carrying the giant globe, right? So we've got Atlas, C1, right? There's a big thing to notice about this, and that's that it does not have a spinous process, right? It does not have that process right there. It does not have it, right? There's no spinous process on C1, the Atlas vertebrae. Let's move to the C2, right? So for C2, we've got the axis vertebrae, right? So if we've got Atlas right here, we've got the axis vertebrae right here. This is C2. This is the vertebrae that the Atlas is going to actually spin on and rotate on, right? That's how we get this head rotation. If you've ever heard of the axis of rotation, that's how you can remember this bone, right? The axis of rotation for our head occurs on the axis vertebrae, C2. Now there's a key feature about axis or C2 that we need you to know, and it's this guy right here, right? What is that? What's going on there? And that's the actual bone that our head is going to rotate on or help kind of stabilize on, right? It's how we kind of notch in there. And it's called the dens, right? The dens or the odontoid process, the dens. That's going to be that jutting protuberance that sticks up through the Atlas vertebrae, and it allows for our axis of rotation. We've got our Atlas and our axis vertebrae. Okay, so we've gone through those, right? Key thing to notice about some of the other cervical vertebrae, right? Here's another cervical vertebrae. So this would sit right beneath that axis and Atlas, right? This cervical vertebrae, it has another couple key features that you probably want to pay attention to. The first one being that its spinous process going all the way from C3 all the way to C6 is going to be bifurcated. What does bifurcated mean, right? Bi, prefix meaning two. Forcated, fork, right? Bifurcated, just like a snake tongue, right? Bifurcation, it just means it juts off into two, right? So we've got a bifurcated spinous process on the top, and then we've also got these two little foramen or holes on the side. What are those called, right? Well, what are these processes called? Transverse processes, right? Hopefully you got that. Transverse processes, these are the transverse foramen. The transverse foramen are just some spaces for arteries and veins to run through up and down our head. But remember that we only have transverse foramen on C3 through C6, aka you're only going to find these holes on the transverse processes in our cervical vertebrae. Okay. All right, let's dive into section 3. So we're going to talk about the thoracic vertebrae, the lumbar vertebrae, and then the sacral vertebrae, including the last couple vertebrae we have called the coccyx, right? But for the time being, let's look at the thoracic vertebrae. That's this one right here. This is also the first one that we looked at in the video to kind of look at general structures, and that's because the thoracic vertebrae are pretty general as far as vertebrae go, right? There's no transverse foramen on the sides, right? And we see that it has all of the typical features that we would normally find on a typical vertebrae, right? And so looking at this, there's a couple things that we need to know that are separate from the other vertebrae, right? We still have our body, we still have our spinous process, but now we have some new facets that we need to get it. New facets, right? New facets of information. Yeah, whatever. Okay. So we've got some new facets that we need to look at. And these are called costal facets or costal facets, right? Costal means rib. Anytime you hear costal or coastal, it means rib. So if you hear costal facet, that's going to mean rib facet, right? So it's going to be this one right there. It's that space right there. And that's going to be where the head of the rib is actually going to slot in and allow for that whole wrapping around the thoracic cage that we see. So we've got our costal facet right there, and then our demifacet directly beneath it. Now, why would it be called a demifacet? Has anybody heard of a demigod? right? Yes, a demigod. A demigod is not a full god, right? A demigod is beneath it, right? We've got like Percy Jackson and all those other ones, right? That we don't really care about. There's the main gods, the demigods, they're less or below those normal gods. No different right here in the case of our costal facets. We've got our costal facet and then our costal demifacet, which is just down beneath it, right? Gonna be in this space right there. Next, we've got the transverse costal facet. So if you remember back to our transverse processes, right? Those are gonna fall along our transverse plane. That's right, it's these right here. So if we flip them onto our side, we can see that they're still following along that transverse plane. And if we've got our costal facet here and our demifacet right there, our transverse facets are gonna be right here, right? And so those kind of connect up with the ribs like so. Let's check it out. So we see the different connecting points on the rib. That kind of hard to see when I've got my fingers on it, but you can kind of see how that's gonna line up right there, right? You've got that top costal facet, that demifacet connecting down beneath, and then that transverse facet up on the side. Okay, so sorry for that getting a little bit blurry there. I am doing this all by myself today. There's not another soul in here. Okay, but for the time being, let's get started on the lumbar vertebrae. So, key thing about the lumbar vertebrae is that they are the largest ones, right? Oh my gosh, so much bigger than all of the other vertebrae that we've seen. And why is that? Why would this vertebrae, which is lower, be larger than this vertebrae, a thoracic vertebrae that's higher? Think about that for a second. Which one bears more weight? Right? This one has more body stacked up on top of it. There is literally more weight being bore down on this one vertebrae versus this vertebrae, right? If it's up right here versus this one being right here, there's more body on this one than there is on this one. And so this vertebrae, the lumbar vertebrae, need to be much thicker to kind of account for all of that extra weight. And so the biggest things about them is that they have a lot of the same key features, and that really the thing that you need to know about lumbar vertebrae is that they don't have the transverse foramina and they don't have costal facets. We do not have ribs down here. We just have them up here in a thoracic cage, right? So there's no costal facets on the side of that. Before we move on to the sacral vertebrae, I kind of want to hold all three of these up and just show you how they look different. So we see that if we kind of point the different vertebrae at the screen or at our face, they look like different animals, right? So we've got this first one right here, right? This is the cervical vertebrae, and it kind of looks like a little mouse, right? You got your ears right there and your little squeaky nose right there. Kind of looks like a little mouse, like that Ralph mouse on the motorcycle. Anybody remember that? Quite the throwback. Anyway, let's get back to some of the real anatomy here. We see the mouse. Now we've got the giraffe. Yep, so this is the thoracic vertebrae. It looks like a giraffe, right? We've got that long nose, our long ears, and then even those little horns that we think about whenever we're looking at a giraffe. So we've got our cervical vertebrae, that's the mouse, our giraffe, which is going to be our thoracic vertebrae, and then the moose, the easiest one to see, right? The moose, which is the lumbar vertebrae, and I don't even want to get into why that looks just like a moose, but it does. It looks just like a moose. It's so perfect. So we've got our lumbar, looks like a moose. Our thoracic kind of looks like a giraffe. And then we've got our last one, right? The cervical kind of looks like a mouse. If you can remember those animals and how they pair in, hopefully it helps you remember these a little bit. Sweet, let's dive into the sacrum. So the sacrum, or the sacral vertebrae, are going to be the last 5 vertebrae kind of at the end of our spine, right? Kind of looks like this. Now, does this look like 5 different vertebrae? No, it does not. Right? It looks like one big hunk of bone, but I promise you that it is 5 different vertebrae and that they've been fused together, right? We've got 1, 2, 3, 4, 5, and oh my gosh, there's more than 5, but that's okay. I can't count. I'm a kinesiology major. Anyway, let's continue. We see that the first thing that we need to know about a sacral vertebrae is that it has transverse ridges. Now, what are transverse ridges, right? Transverse ridges, remember your transverse plane running this way, right? Transverse ridges are going to be the fusion points of those vertebrae, right? We see those raised ridges, right? Transverse ridges. If you run your finger along it, you can feel the ridges, and they run transversely. Next, we've got the anterior sacral foramina. Now, it can be kind of hard to orient this, but just remember, right? This is cupping around the back or the back portion of our body, right? It's gonna cup up around like that, kind of up and around our anal cavity. And so from there, we've got anterior this way, posterior this way. Anterior this way, pointing it to the front. We see that we've got the anterior sacral foramina, right? I'm gonna use my pen here, that way my fat fingers aren't in the way. There are the anterior sacral foramina, right? We see that there's quite a few of them. Conversely, on the other side, we've got the posterior sacral foramina, right? And if you have been attentive, you'll see that those go straight through, right? And that they are the same hole, just different openings. So you've got your anterior sacral foramina and your posterior, they're paired. It's the same hole through the bone, same hole, two openings. Front side is anterior, back side's posterior. Okay, feel good about that? Let's move into the superior articular process and facet. If we remember back to some of our other vertebrae, right, we see that they have these different superior facets right there and inferior facets, sorry for the fingers, but we see that little connecting spot, right? Inferior facet and superior facet. The superior facet of the lower vertebrae connects to the inferior process of the upper vertebrae. No different going on with our sacrum, right? We've got these two little spots up top, and if we took the vertebrae, right, and placed them on there, you'd see that those are gonna line up just perfectly with those two processes that we pointed out, these guys right here. So these two bony processes are the superior articular process and facet, right? They're going to articulate with the spine above it. See that? Alrighty, cool. Next, if we flip this around, we've got the sacral promontory. If you look at this bone, what is the most prominent part of this bone? The first thing that you see, right? The sacral promontory. It is the most prominent looking portion of the sacrum. It's the very top, right? And what happens right there, that's where the end of our spine occurs, right? We are load bearing. Oh, look at that, I almost fell. We are load bearing with this thing. So there's a huge connecting point, fibrocartilage right there, trying to preventing that compression and trying to make sure that we keep our spine nice and upright. So that is the sacral promontory, this big flat region up top. Next, we've got the ala, right? Ala, whenever you see the term ala in anatomy, you know that ala means flared wing, right? Flared wing, it's all flared out. Look how flared these two pieces of the bone are, right? We've got these two flared regions right here. Those are going to be our ala, or the flared wings of the sacral, or of the sacrum. Next, we've got the coccyx. So we've talked about all of the sacrum except for this weird little region down here, right? We've got this strange little spot going from this point to this point, and that's going to be our last 3 to 5 small vertebrae called the coccyx. This little guy can break off, and it's not a very pleasant experience, right? It's difficult to heal, and since it's so small and in a strange spot, it can be very, very painful for people and put them out for a while. But yeah, don't want to break your coccyx, which is at the bottom of your sacrum. So that's all of the vertebrae. Now let's go ahead and dive into the thoracic cage. Okay, so we've got 2 more bones to look at before we complete our thoracic cage. Let's go ahead and start with the first one. So first, we've got the sternum. So the sternum's gonna sit kind of right here, and these little clear things jutting off are kind of meant to symbolize the ribs that would be coming off and connecting from my spine, right? And so looking at this is our sternum. The first structure that we want to point out is the manubrium. And the manubrium is going to start right here and go to right here, right? This top part is the manubrium. If you imagine that the sternum kind of looks like a tie, right? Do you see how it looks like a tie? It'd wrap up around right here and just, right? Yeah, that top part, the manubrium, is the tie of the tie. It's that knot up at the top of the tie, right? Next, we've got the suprasternal notch, right? The supra, up, right? Supra means up, sternum, this whole thing's the sternum. Suprasternal notch is going to be at the very top. It's this notch right at the top of the manubrium, right? Next, we've got the sternal angle. The sternal angle is going to be that border at the bottom of the manubrium, right? It's this line. You can kind of see it right there. Some of the models have it penned in really well, and so you can kind of see where that sternal angle is, and it's angled, right? Alrighty. Next, we've got the body, right? So if this is the manubrium of the sternum, the rest of it's going to be the body, right? This is all of the body down from right here to right here, right? We've got the body of our thigh, aka the body of the sternum. And last but not least, we've got the xiphoid process. Some people have heard about that one. It's kind of a unique term that people kind of hold on to when they memorize it. But the xiphoid process is just that little jutting off at the end or the bottom of our sternum, right? Sitting right there. You can kind of feel it down there as well. It's just the very bottom of that sternum, the end of our thigh, right? Okay, so we've got the sternum all figured out. We're on to our last structures. These are the ribs, okay? The ribs can feel a little bit weird, but let's try to get them oriented, and I promise they won't seem so bad. Okay, so we've got a rib right here, right? And all the ribs generally look the same. There's not much different with them. But importantly, there are different, before we get to this, there are different types of ribs. So we've got the true ribs, the false ribs, and the floating ribs. The true ribs are going to be the first 7, right? So we've got 1, 2, 3, 4, 5, 6, 7. What we notice about all 7 of these, right, including this one right here, is that they don't share any of these clear juttings off of the bone, right? See how this one had, or this, let me find words. This rib, this rib does not share any cartilage with another rib to try and connect back up to the body of the sternum here, right? There's no cartilage being shared along this line. However, we see that these ribs are sharing cartilage. There's 3 of them sharing this piece of cartilage that goes up to the sternum. Going from 7 on up to the top, those first 7 don't share, right? They have their own. Those are the true ribs. They have their own cartilage. The next ones, right, 8 through 12, those are going to be the false ribs. False ribs are going to be, right, these last couple. False ribs, they do share that one line of cartilage, right? So it's not this one, it's got its own. These 3 right here, running up into the body of the sternum. And lastly, we've got floating or false ribs, which are going to exist kind of down here, and they don't connect back up onto this guy, right? They're not connecting back up onto the sternum. If we had them continuing here, we would just see a rib right here and a rib right here. Those 2 ribs are floating, aka they do not attach to this midpoint. If you need help remembering those, just remember back to our vertebrae, right? How we had 7 cervical vertebrae, 12 thoracic, and 5 lumbar, right? If you can kind of use that to remember these as well. We've got 7 true ribs, 1, 2, 3, 4, 5, 6, 7, right? And then you know that once you get to the 7th one, that there's not much ribs left. So once you get to 7, you've got 12, right? 1, 2, 3. So we've got 7, first 7s when we eat breakfast, and the rest of them, that's 8 through 12 is going to be our false ribs, and floating, our last 2, that's going to be the floating false ribs. So I know that got a little bit muddy right there, but try to memorize the numbers of these, and if you need any help, reach out to me or reach out to anybody else who's working. We'll try to come up with some better mnemonics or some better devices. But anyway, for the time being, let's get into the actual individual ribs. So if we're looking at a rib, the first thing we need to do is orient ourselves. So looking at the rib, you'll see that one end is kind of flat and does not have any real defining features on it, okay? That's not the end that we're concerned about. That's the end that's gonna be kind of inserting in onto, or sometimes inserting in onto the sternum, sometimes just floating, right? You're gonna take a look at the other side. Bam, there's a lot going on this side, right? We've got a couple bumps here, bumps here, bumps there, and we're gonna name all of them. So the first thing that we need to know is the head of the rib. Okay, I want you to know that there's a cut right there because I totally spaced which end was actually the head. But I'm with it now, we're ready to go. So if we look back at the rib, we've got this flat head right here, not head. We've got this flat space on the rib, right? This is not the end that we care about. This is the flat, non-descriptive, non-specific space on the rib that's going to go up into our sternum. If we flip to the other side, we see this other side of the rib, which is called the head of the rib, right? The head of the rib has a couple of bony prominences that we want you to know. And so the first thing that we want you to know is that this is the head of the rib. It's followed by the neck of the rib. The neck of the rib has a couple of things on it that we want you to know. And the first is the tubercle. Whenever you're holding a rib, the tubercle should face down. So that's the tubercle right there. The tubercle is going to be one of the articular regions that we see, and with the rib, it actually is going to connect to that transverse process, right? Or those transverse facets. So if we've got the tubercle right there, we've also got our articular facets. That's going to be right here and right there. So right there and right there. Those are going to connect onto the vertebrae. If I don't have my thoracic vertebrae right here, but if we remember, we have that costal facet and the demifacet, right? The costal facet's going to connect right here, the demifacet's going to connect right here, and then the transverse facets connect right here on the tubercle. So we've got the articular facets, bam, bam. Superior articular facet, inferior articular facet, transverse articular facet, which I don't believe is on there, but it's a bonus one for you. All right, next we've got the shaft of the rib. That's the shaft, right? The entire thing, this whole big old shaft of the rib, pretty easy to find. Next, we've got the costal groove. The costal groove is not nearly as easy to find. So if we take this whole thing and we flip it, we look on the interior portion of our rib. I'm gonna try to hold this. If we look on the interior side of the rib, you can see this groove that runs all the way to the end of the model, right? It's this special little groove that runs all the way to the end of the rib. Kind of couldn't really see that run of it. Let me do a better job. Can you kind of see that groove? Awesome. If you can't, ask your models about, or ask your labs about it, or your lab, I cannot speak, your lab TAs about it. They will point it out much better than I can using this poor resolution. But look for that costal groove, okay? It's very important. It runs on the inside portion of this rib. Next, we've got the angle. What part's the angle? Yeah, it's the most angular portion of the rib, right? When it comes off of the body, we've got this super angled spot. That's the angle of the rib. The problem with the rib is that there's a lot of pieces of it that are kind of double named, right? Like if we talk about the shaft versus the angle, right? There's not much a difference there, but knowing that the angle is the more angular portion versus the shaft is the whole thing might help you. Also, really pay attention to those different facets that we talked about, right? Make sure that you know how to orient this. If you see the tubercle, make sure you know how to find those two facets on the end. Okay, that is all of Lab 3. Good luck on your quiz this week, and I'll be in touch.